How often should a chiropractic patient get adjusted? Well, the answer to that is it depends. There is no one answer for that question. The first thing that I can guide people towards, it really depends on the technique that the chiropractor is using. Some chiropractors just adjust the top two bones in the spine, and that's a very powerful technique, and the philosophy behind that is if the first two bones are in alignment, everything else should be fine. You know, I've seen chiropractic patients that have gone through years of that, and the top two bones are really in a good position, and again, that's very powerful because that means there's no pressure on the brain stem, the spinal cord, and the nerve roots. But I've done analysis of the rest of the spine, and there's problems throughout. Some chiropractors just adjust for pain, and you know, if that's what the patient wants, that's okay. You know, they come in with back pain and headaches, pain shooting down the leg, sciatic pain. Chiropractor does an assessment of the spine and finds that subluxation or the movement of the bone and puts it back, and the pain is gone. And sometimes the patient is gone when that pain is gone as well. What we do in our office is spinal correction.
Pause.
Thank you.
I learned that the spine keeps you healthy. It's what you need to.
When I came here and actually understanding how the spine, when it's out of alignment, how it's putting the pressure on those nerves.
Come here. Change your lifestyle. What had happened to me was already in progress, but I don't think my outcome would have been as good as it has been if I hadn't been doing what I was doing here.
And I don't like to analyze the patient and give them a care plan based on pain or symptoms. I don't want to just adjust the top two bones in the spine. I want to see the position and the condition of the spine. We've taught our patients that you should have three curves in the spine, one in the neck, the mid-back, and the lower back, and you should line up completely straight. You should also have no degeneration or arthritis through the spine. If you keep your spine in its proper position, there should be no degeneration and arthritis in the spine anyway. We analyze the spine, we assess it, we see what phase of degeneration, if there is degenerational changes in the spine, what phase it's in. We weight the spine and re-x-ray them to see how easy or hard it is to move the spine, to see if there's any fusion of the bones and if the spine actually shifts and moves or if it's stuck. And those things will determine the frequency of care. In our office, there's two different phases of care. There's the corrective phase. We're gonna go after the spine to correct it. We're gonna start to transform the ligaments and tendons and muscles to get back into its proper position. Again, three curves at 45 degrees. And sometimes that takes some time to do. Years of damage, sometimes months of care that will take to get it back to where it needs to go. Then there's the maintenance phase. So after the correction, we need to maintain it. If you don't maintain it, it's like not wearing retainers after you wear braces. You take those braces out, you don't retain the correction, and the teeth go back to where they were. Same thing happens with the spine. We correct the spine, we get those amazing, beautiful curves back into the spine, and if we don't maintain the correction, you go back into your everyday positions that put it in there in the first place, and it reverts back to where it was. So in our office, again, there's two phases: the corrective phase where we're aggressively attacking and changing the spine, and the maintenance phase where we're making sure that it doesn't revert back to where it was. So how often should you get adjusted? Well, it really depends on what technique the chiropractor is using, what the goal and the outcomes are, and what phase of care that you're in.